Hello, my name is Landon Bridges, and I am with Joe McCudden, Certified Athletic Trainer at Manchester University. He is the preceptor for the Manchester wrestling team, also their women's soccer team. I'm here just to ask him a few questions based on evidence-based practices and his opinions on them. But first, I'd have to ask, what do you understand what evidence-based practice is?
Yep, evidence-based practice is the BOC's push to bring athletic training into the current era of continuing education. A lot of other areas, including physical therapy and OT, all have evidence-based practice for continuing education. So we're trying to play a little catch-up and take the most current research and practices that are out there and bring them into the clinic setting.
Very nice. And how would you utilize evidence-based practice in the athletic training room?
In the athletic training room, it comes down to documentation and using patient-related outcomes to find out if what you're doing is actually working. Just because you've done it or your preceptor or previous instructor has done it for years doesn't mean that this is the best option. It means there could be better options out there, and unless you ask your patients on a consistent basis, you don't know if what you're doing is actually making them feel the best they can.
Gotcha. And do you feel prepared to practice evidence-based practices?
I do. It was a little difficult at the beginning when they first rolled this out. Not many evidence-based practice CEUs were available, but since they rolled that out a couple of years ago, more and more places have applied and been able to offer evidence-based practice, and I don't find it any more challenging to get those CEUs versus a regular, what would be considered regular CEU.
Understood. And final question, how much experience do you have with evidence-based practices?
These standards rolled out right after I graduated from my undergrad accredited program. Our professors saw this coming, and so from my sophomore year on, I've been trained to kind of look for these kind of things this whole time. So I felt prepared, and when I found out these changes were coming, my first response was, we're not doing this already. So overall, I think it was a pretty positive thing and pretty easy for me to just continue doing.
All right, just a follow-up question. Is there any ways you're preparing your current students on evidence-based practices?
The best thing that we do is just constantly find out from the patients if what we're doing is working. And that's through showing these patient-related outcomes, whether it's the dash for the shoulder or the foot and ankle mobility screen, and there's a few others that we use for the back and whatnot that we can use and just find out. Just because I've done it one way doesn't mean it's the best way, or there aren't other ways that you can't achieve the same goals.
All right. Thank you for your time, Joe. I appreciate the interview.